while my baby was eating, I would hop on and do a Q&A, see if anybody has any questions that I can answer about breastfeeding, pregnancy, labor, birth, postpartum, motherhood, anything is welcome. So I am here if you have any questions at all. I am Shelby. I am a former labor and delivery nurse, a birth and postpartum doula, and a lactation consultant. I have a private practice and I also practice in the hospital setting. I work in 2 hospitals per diem, and I'm currently on maternity leave with my 7-week-old newborn, and I also have a 2.5-year-old. So that's a little bit about me and my background. I've recently found I'm very passionate about the education piece. I never thought that that was my forte, but through being a doula, I have found that I really, really enjoy the education piece. I have had a few questions on my other social media accounts recently, one of them being about breastfeeding after a breast reduction. Someone was asking how to go about breastfeeding if they do have a history of breast reduction. And I did respond to them on there, but I feel like that is probably a common question. After any breast surgery or trauma to the breast, there is a risk of not being able to get a full milk supply. It depends on the type of surgery and what went down during the surgery, what nerves and structures were cut through during it. So every surgeon will have a different style and every surgery will be a little bit different. So I always say that you should go into it like you are going to be able to breastfeed. You should get the education, hook up with a lactation consultant prenatally so they can do a full assessment on you, get your full health history, determine what kind of surgery was performed to see how likely it is that it will impact your breastfeeding journey. They will be able to tell by where the scars are, what kind of procedure was done, and how that will impact your breastfeeding journey. So I would get educated, work with a lactation consultant prenatally, make sure that you're lined up to work with them postpartum as well. You can check your insurance eligibility through platforms like the Lactation Network and Wildflower Health. A lot of lactation services are covered by insurance, so definitely check that out. But I would, besides getting prepared beforehand, once baby arrives, do lots of hand expression. That helps to bring your milk supply in, give you that stimulation. It's also good to get baby that extra volume. Latch baby early, we say within the first hour is ideal, but as soon as they show signs of wanting to eat, their hunger cues, have them skin to skin immediately after birth if possible, and help them latch as soon as they can, ideally within that first hour. If you are separated from baby, you want to be doing that hand expression or pumping if you're not going to be reunited with baby quickly. And then you're going to want to continue to offer the breast to baby at least every 2 to 3 hours, but that is just a guideline. We never want you to hold off on feeding baby until the 3-hour mark if they are showing cues beforehand. So it really is on demand to establish that full milk supply and give you that stimulation that's needed in the first few days. Your milk supply is really dependent on how much you are stimulating the breast in the first few days. That has a lot to do with your long-term breastfeeding success. So we definitely want to be on top of that right after baby is born. Skin to skin is always amazing for your milk supply and for your baby. So that helps to release oxytocin, which is what helps your milk let down. And that is great for your milk supply and also for your postpartum recovery and for babies' regulation as well of their vital signs, their temperature. Skin to skin is amazing. And then if you do have any issues, you notice that baby isn't content after feeds, or they're losing more weight than we would expect, which is usually we want it to be under 10%. If it's creeping up to 10% weight loss, we want to evaluate what is going on. Weight loss is normal in every newborn, but we don't want it to be excessive. We also track how they are doing by their pees and poops. So it depends on how old they are for how many we expect. But you do want to make sure that they have adequate output and there's no other signs of dehydration either. If you are noticing that they are not peeing and pooping enough, they are having excessive weight loss, they're not content after feeds, if their fontanelles are like caved in, like sunken fontanelles, that would be a sign of dehydration that you're going to want to let your pediatrician know about. You will be monitored at the pediatrician's office within a few days of hospital discharge and at 2 weeks and 4 weeks and 2 months. But if you have any concerns outside of that, definitely let your pediatrician know. So those are the things that I recommend if you have had a breast reduction or breast surgery in general, is to basically treat it like you are going to be able to breastfeed, do all the normal things that you would do on a typical breastfeeding journey, and then definitely get support early if needed. And be aware that there is an increased risk of a lower milk supply if you have had a previous breast surgery. Hello, everybody. Thank you for being here. Does anybody have any questions about breastfeeding or birth, postpartum, motherhood, anything I can answer for you? Happy to answer anything at all. I'm just hanging out with my little 7-week-old baby currently. You might hear him in the background. I had my tripod set up all nice, but I can't do it where I'm currently sitting, so sorry about that. Another question I got recently was about antenatal or prenatal hand expression to collect colostrum for baby after birth. Most providers say that after 37 weeks, if you don't have any risk factors, you can start hand expressing. Some providers prefer you to be 39 weeks, which is now what we consider full term. They used to say 37 weeks, but we now say 39 weeks is full term. So some providers do prefer that you wait until that 39-week mark, just so you're not stimulating contractions, stimulating your uterus, and causing you to go into labor before a baby is fully ready. Although usually, as we know, we can't really get labor to start unless your body and your baby are ready, even doing all the tricks. But to be extra cautious, some providers do ask you to wait before you do any aggressive nipple stimulation. But generally, 37 weeks is what providers will recommend, that it's safe to start hand expressing for like 15-20 minutes at a time. You wouldn't want to do that if you have a risk of preterm labor, or if you have any reasons why they don't want you to go into labor, like placenta previa, bleeding, anything like that that they're concerned about or watching you for. Anything that makes you higher risk, you definitely want to run it by your doctor if it is safe to hand express prenatally. It really is a personal preference if you are going to hand express to collect colostrum beforehand. It's definitely not a requirement. It's a great thing to learn. Hand expression is a great tool. In the first few days after birth, it's best to hand express rather than pumping because it's a little bit more effective at getting the colostrum out. The colostrum is very thick, so sometimes the pump has a little bit of a hard time getting the colostrum out. The pump at the hospital is really good for stimulation to encourage that milk supply to come in, but the hand expression is super effective and also helps to get that thicker colostrum out. If you do know that your baby might need a little bit of extra volume after birth, then it could be beneficial to have that colostrum on hand. If you have gestational diabetes, if you know that baby is going to have NICU time, if baby has a risk of being born early, if baby is expected to be bigger or smaller, they might have blood sugar instability. So having that extra volume on hand is helpful if you're not planning on using formula. So those are some reasons you might want to hand express prior to birth. Definitely not a requirement, but an option. Some people just like to have a little bit in their freezer as backup. You do still need to be stimulating the breast at least every 2 to 3 hours after birth. So it's not to replace that stimulation or those feeds, but just as a little bit of extra volume if needed. The colostrum is also really nutrient dense and has a lot of amazing antibacterial, antiviral properties. So it is good to just have in your fridge, like for any illness, anything like that. But the breast milk does change as you are feeding baby. So if they do have any illness, your body takes that information in through breastfeeding and makes what is necessary to fight off those germs. So having colostrum on hand isn't completely necessary, but it is a nice thing to have. One moment, let me get my baby here. Does anybody have any questions that I can answer for you? How to give birth? Well, that will kind of vary person to person, but obviously it is a very natural process, and typically your body will know what to do without you doing much. Do you have a more specific question about giving birth? There are obviously lots of different ways to do it. Lots of people go into spontaneous labor. Induction is an option. Elective C-sections, repeat C-sections. There's lots of different ways that babies join us. I did just post my own birth story on my channel from my second son's birth. He was born last month, or actually it's September now, so he was born in July. He's 7 weeks old. It was my second unmedicated hospital birth. It was a really great experience. I did give birth where I work as a lactation consultant, and I also worked there as a nurse, a labor and delivery nurse. It was a LDRP unit, so it was labor, delivery, postpartum. We circulate in the OR. So a little bit of everything, but I did work there as a nurse, and now I work there as a lactation consultant, which I absolutely love. It's definitely my dream job and the place for me to be. But yeah, I did have an amazing experience for the second time. I think it helps a lot to know the people that are there when you are giving birth. It helps a lot with that anxiety to be surrounded by people who you know and who you're comfortable with. So I definitely love that about working at the hospital that I gave birth at. But if you are interested, you can check out my second birth story video up on my channel. It was the last video I posted a few days ago. I will be recording my first birth story as well. In the next few days here. Okay. Usually I'm not like a huge burper unless absolutely necessary, but my little guy is definitely a gassy baby, so if I don't burp him good, he is not happy. Well, my little guy is not falling asleep like I was anticipating. You can fall asleep. Hello. Anybody have any questions that I can answer while we're here? If you are just joining, I'm Shelby. I am a former labor and delivery nurse, a birth and postpartum doula, and a lactation consultant. I'm also a mom of 2, so if you have any questions related to any of that, I am happy to answer them. Hello to the people just joining. Welcome. Is anybody here currently expecting or recently given birth? Yeah. This is literally the only way to get any recording or work done is to have a baby on you. If you're a mom, you know, I am sure. I always like to wait until everything is perfect. I'm definitely a recovering perfectionist, but I've learned being a mom that you can't do that. If you want to do things, you just got to do it and accept that it will not be perfect every time. You're not a happy guy. All right, well, if nobody has any questions, I'm going to hop off because little guy wants some one-on-one mom attention. But thank you so much for joining. I will chat with you soon. Bye.